Although breast cancer is more rare in Black women compared to white women, they have a much higher risk of death due to this disease. In the United States, the death of breast cancer, which is adapted to the age between 2014 and 2018, is around 40% higher among Black women than among non-Hispanic white women. This death gap is likely to reflect the fact that Black women face substantial obstacles to obtain high-quality medical treatment on time compared to white women. The main writer Ismail Jatoi, MD, PhD, the Center for Health Sciences at Texas University, San Antonio, and his colleagues suggested in this new opinion. This article was published online June 18 at the New England Journal of Medicine. When the team examined statistics for breast cancer death, they found a surprise. The gap of death between the race only came from 1980. Before 1980, the death of breast cancer among Black women was slightly lower than white women, Jatoi and his colleagues showed. That year was a turning point in breast cancer management, as in 1980, the two mammography screening and endocrine therapy were available. This is also when the gap of death between the race began to emerge. Differences in access to two new interventions that trigger differences, as suggested by the author. Why this happens quite clearly, their comments. Black women are more likely than white women because they do not have health insurance or have inadequate coverage, who have limited their access to mammography screening and therapeutic decision-making that have a bad impact, showed the researchers. In addition, mammography screening and endocrine therapy mainly benefit patients with breast cancer hormone receptors, who are the same common in Black and white patients. However, Black women have 65% higher HR-negative cancer rates than white women, and HR-negative tumors are often detected during intervals between mammography screening tests as clear cancer. Black women also have a level of 81% higher than triple-negative breast cancer, so they benefit less than mammography screening and delays endocrine therapy, which both support the detection and treatment of HR-positive breast cancer, the authors emphasize. Some people suggest that excess HR-negative breast cancer in Black women may be explained by hereditary factors. But as shown by Jatoi and his colleagues, the incidence of HR-negative breast cancer has actually fallen in all